You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. On today's episode, I will be discussing IVF treatments and what you need to know about IVF. What is IVF? A lot of people still don't know what IVF is. I still get some inquiries on IVF. So if you're in this category, this topic is for you. So let's break down IVF and everything you need to know about IVF. IVF is a method of assisted reproduction in which a man's sperm and the woman's eggs are fertilized outside the woman's body in the IVF lab, and the embryos generated returned back into the woman for implantation to take place. Before this time, the woman would need to take some drugs, some injections before the eggs will be, retrieved from her. So she needs to get some injections, and once the follicles are matured, then the eggs will be retrieved from the follicles and fertilized in the lab. And by day 5, the embryos will be transferred back into the woman for implantation to take place. Okay, so that is what IVF is all about. You might want to ask if there is a serious complication that could arise based on IVF medicine or the procedure, generally with the whole treatment. Yeah, there are some risks that could occur. There are some, minor risk could occur, even major risk could occur, and this is why I would emphasize that when you're doing your IVF, make sure you use a fertility expert that knows this very well, knows how to retrieve eggs very well, because egg retrieval itself is a very risky procedure. So let me quickly just talk about some of the other risks that could occur during IVF treatments. Okay, you will have to get a lot of injections, gonadotropins, all these IVF drugs, to stimulate your follicles, and a numbers of follicles from it, eggs will grow, and possible side effects could occur with the injections. You could have mild bruising, you could have soreness, and you could have soreness at the injection site. You could also have nausea and occasionally vomiting. You could also have allergies, temporary allergy reactions such as skin reddening. You could also have itching at the injection site. You could have breast tenderness, mood swing, fatigue, and the most important risk of IVF, OHSS, which is hyperstimulation. Yeah, is ovarian hyperstimulation syndrome, OHSS. So you could have OHSS. OHSS could be mild, and it could also be severe. Some OHSS symptoms are nausea, bloating, ovarian discomfort. All these are mild, and with time they would go away even before your embryo transfer. But in severe cases of OHSS, it can cause large fluid to build up in your abdomen and lungs, and this can cause very enlarged ovaries, dehydration, trouble in breathing, severe abdominal pain, and very rarely, in less than 1% of time, women having egg retrieval, can have OHSS, which can lead to blood clotting and also some kidney-related issues. Talking about the next point, which is egg retrieval, what are the risks of egg retrieval? Earlier on, I said that egg retrieval process is a very delicate process, and because of this, you need to use a fertility hospital that are specialized in egg retrieval process. During egg retrieval, what your doctor tries to do is he will make use of an ultrasound to guide the insertion of a long thin needle through your vagina into the ovaries and then into each of the follicles to retrieve the egg. So the possible risk for this procedure, yeah, could include mild to moderate pelvic and abdominal pain, and in most cases the pain disappear within a day or two as well, and can be managed with over-the-counter pain medication. Yeah, there could also be injury to the organs if you're using a doctor that is not that versatile in egg retrieval, maybe somebody trying for the first time or second time. But be rest assured that if you use a specialist that has done this over and over and over again, the likely possibility of you having an ovary injury, is very, very, little. So try and use a doctor, a specialist that is versatile and knows egg retrieval procedure very well. Even I'm talking most importantly, donors. You don't just walk into a place and say, oh, I want to donate egg, because the egg retrieval process is a delicate process on a general, so but not something to worry about if you're using an expert. Okay, so that's just what I would say. Okay, so apart from the injuries to the ovaries, in very rare occasion you could have blood vessel injury, which might cause an emergency surgery, and occasionally blood transfusion might be needed. Okay, you can also have pelvic infection. It could be mild to severe. Pelvic infection could be as a result of the egg retrieval and also the embryo transfer. Okay, usually medicine are given at the end of egg retrieval so that you will not have infection, but sometimes there could be an infection that might require you to go back to the hospital. You could have a severe infection that may be required to remove one or two of your ovaries and the tubes or even the uterus. So women who have had pelvic infection or endometriosis involving the ovaries are more likely to get IVF related infections. Okay, let's talk about the risk associated with embryo transfer. Well, embryo transfer is not a very delicate procedure. What the doctor is going to use this time is the catheter. The embryos will be placed through the catheter and back into your womb. So after the transfer, you could have mild cramping, and you could have vaginal spotting after the transfer. So you could also have some mild infection because of what was inserted into you. So usually you can take antibiotics to treat all that. So like I said earlier on, embryo transfer is not a tedious or a risky procedure. Okay, so at the end of your embryo transfer, try not to go home immediately. You could at least lie down for 30 to 1 hour before you stand up and go to your house. Okay, so I do get this question, this question that says, is IVF pregnancy more complicated than natural pregnancy? Well, I know that pregnancy is pregnancy. That is the truth. But IVF pregnancy requires some more attention. You have to pay attention. You can't afford to spend all that money, and at the end of the day, you want to treat it like it's natural pregnancy. Of course, for the first trimester, you will need to still be on some IVF drug. I know some countries now, they are trying to change that. Some have reduced it to first 10 weeks. Some are trying not to use it again. But here, man, we still practice the 3 months. You have to be on the IVF drug for 3 months, because this is not a natural pregnancy. The hormone still needs to be sustained. Okay, yeah, so in that way I would say that pregnancy is different from natural, but the babies are not different. It is the babies are babies. Do you understand? Okay, it's just the process now that I'm talking about, the process of you now giving birth to them. You need to treasure that process if you do IVF. Then apart from that, IVF pregnancy most of the time can come with high multiples order, okay? So because usually more than one embryos will be transferred into you, and the implication of that is that if all of them implants, you would end up having more than one babies. Some countries have reduced the numbers of embryos they can transfer into the womb. Some countries will do one, some will do two, but in Nigeria we still do 3 embryo at most. And I think that yes is the best thing to do, because that would at least give the embryos opportunity to see which one would implant and which one will not implants. Okay, so because of the high multiples order, if you're having triplets, for instance, the implication is that your baby will be delivered prematurely, and so you would have to incur neonatal intensive care costs, and also the health risk also is there for the baby. The lungs are yet to be fully developed. You could tell on them, but yeah, most of the time the babies usually would do well at the end of the day. Okay, so these are what the procedure called, or the treatment option called IVF is all about. Okay, so it's a fertilization that takes place outside a woman's body. Yes, the success rate of IVF is not 100%, and yeah, to a very large extent, it's better. You can get pregnant with IVF more than natural conception. Okay, so the chances is quite higher that you'll get pregnant using IVF. That is if there is infertility. Okay, if you have need for it. Okay, so the chances are that IVF could help you out, because it helps you to definitely boycott some of the conception processes. Okay, and just take you straight to the womb. Okay, so for instance, if you have fallopian tube blockage, yes, you could consider IVF. If you have sperm issues, you could consider IVF, because IVF using a method of fertilization called ICSI would help men with sperm issue. Okay, thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. I hope you've learned something. Okay, so for more enquiries, please comment below for consultation or for appointments. Kindly call the number showing on your screen. Okay, so you could also send us a DM and follow us on our Instagram page at Meet Surrogate Mothers. Okay, please don't forget to subscribe to our YouTube channel and share the video. Thank you.